Hello friends, this is Dr. Murtaza Adib. I practice joint replacement surgery in Pune, and today I am going to discuss a very common topic amongst patients, especially patients who are going to have a knee replacement operation. And they commonly ask that what kind of movement can we do after a joint replacement or a knee replacement surgery. So I'll just start off by explaining what a normal knee looks like. So this is what a normal knee looks like. It is well aligned, as you can see, and it's nice and smooth at the joint surface. Okay, so if you develop arthritis, then the joint surface becomes quite rough, and this is what a arthritic knee looks like. So this is all rough now here, and as you can see on both views, and the knee is slightly bent, etc. Okay, so these kind of patients would require a total knee replacement, and after a total knee replacement, this is what a knee would look like. So this is the implant, the silver bit on top, and at the bottom, and the knee is in a straight line now. As you can see, this is what it looks like. So a normal knee can bend from 0 to 140 degrees of flexion, and after a knee replacement operation, patients usually get a range of movement from 0 to 120 degrees. At least most of my patients do, and you are basically allowed to do any activity that can be done in this range of movement. So if you want to sit on the floor, cross-legged, etc., that can be possible. And you can also pray namaz, etc. A lot of the patients want that, so that also is possible. I'll just post a few photographs now after the video. These are my patients who've had bilateral knee replacement done. One of them I think is 12 years, another one is 13 to 14 years, and one of them is at least 4 to 5 years post-operation. So you can have a look at that, and then you can figure out how much they can bend. Thank you.